All right, welcome everybody. I'm Dr. Jess Sally here at Regenexx Pittsburgh. I'm going to be giving the webinar tonight. Today we're going to be talking all about ways to sort of perform regenerative treatment and treatment of acute and chronic musculoskeletal issues with alternative measures to surgery, using your own body's cells and alternative methods to help you heal and become more pain-free. So I'll get started here, and I'll take a lot of questions at the end. So bear with me and enjoy. So we're going to start just with a quick introduction. Like I said, I'm Dr. Jesse Sally. I got my undergraduate education from Virginia Tech, also my medical education from the Virginia College of Osteopathic Medicine. I was a resident at UPMC through the Physical Medicine and Rehabilitation Department, and I also received my fellowship in sports medicine and spine medicine through UPMC as well. Avid snowboarder, cyclist. This is our practice, Regenexx Pittsburgh. These two fine gentlemen to my left are my senior partners, Dr. Mark Adelsheimer and Dr. Lieber. They've been in practice together for the better part of over 20 years. I just recently joined up with the practice almost 6 years ago now. We have locations all throughout the Pittsburgh area. Our main office is in the Fox Chapel area of Pittsburgh. We have a few satellite locations to the north and sort of all directions around the city. So you can access us at any of those satellite locations as well if you'd like to talk more. So let's go through a little bit of the history of Regenexx. Regenexx was actually the first company, or I guess the first providers in the United States to provide stem cell treatments for orthopedic conditions in humans. They started doing this back in 2005. Chris Centeno was the person that pioneered this first in Denver, Colorado. Regenexx overall has done like most of the research that has been published regarding stem cell treatments, and also done the majority of the treatment protocols that we use for injections in most of our treatments. It's safe. So there's been large safety papers that have been published by Regenexx that have given a lot of good evidence to the fact that these stem cell treatments are not only just very effective, but they're also very safe to implement in patients and used routinely. And like I said, it's well researched. Regenexx has its own lab-based system in the headquarters in Denver. It's a very, very, very highly scientific lab. Most academic institutions in the United States would probably be jealous of this lab. So any research that they are doing on these procedures and how it affects cells and how it affects joint structure is very high level. So why are you here? So you're here for me to kind of tell you what your options are, I think, in terms of how we manage pain and how we manage any issues that you have moving forward. So there are a lot of different reasons that people seek out these regenerative treatments. It could be because they are experiencing pain, and obviously we don't want to have that, and we want to do whatever we can to get rid of that. But we also want to do it in a way that is the easiest for you and also gives you less downtime and less recovery time. So, you know, people want to do whatever they can to avoid surgery and avoid any nasty complications or prolonged recovery that may come with that. Some people, you know, if you're higher in age, or if there are other medical comorbidities, you may not be a surgical candidate to begin with. So that can be a hurdle. You know, people want to know their options. So I'm just kind of presenting you with the different ways that we treat things. You know, a lot of people don't want to rely on meds. People don't want to be told that you just have to live with it or to come back when you're ready to have surgery or when you can't, you know, function anymore. People just aren't ready to slow down and just, you know, they want more out of their daily life and daily function. So what are the obstacles that kind of get in the way of seeking some of those additional treatments? Money, obviously, is a big one, I think, for a lot of people. A lot of treatments that we do don't fall under the umbrella of normal insurance coverage, and that can be a little bit intimidating for people. Time is a big issue. People want to know not only how long the procedure is going to take, but also how long is it going to take to recover? How fast am I going to be able to get back to doing what I want to do? And am I going to lose anything waiting for that to happen? There's a lot of confusion. You know, people have a lot of questions about these procedures. There's a lot of mixed information out there on the internet and in the media. So I want to try to provide you with some additional clarification today about any questions that you may have. Fear is a big one. You know, people don't really know what to expect from these procedures. Is it going to hurt? You know, what are you going to be doing? How are we going to be approaching it? Will you numb the area? You know, all these different questions. And of course, you know, we do everything that we can to keep our patients comfortable. There's minimal discomfort with these procedures, and we'll kind of talk through what that looks like. And then obviously trust. You want to know that the person that's giving you the treatment is going to be somebody that's reliable, somebody that's well educated, somebody that's very practiced in administering these treatments. And we're going to talk about how we differ in terms of how we're trained and how we're able to deliver these treatments more effectively than most. So goals really today are to help you see really an alternative choice in your care. We're going to help you discover if you're a candidate. So we'll answer some of those questions. And then we'll tell you how to help get scheduled for a regenerative consult to get all your questions answered in person. I mean, there's only so many pieces of information I can give you today. You know, if there are a lot more specific questions, it's best sometimes to just come in and talk to us face to face so we can kind of get everything answered for your specific problem. So we'll talk a little about what Regenexx is. We'll talk about some of the current options that are present in just Regenexx as a provider network. We'll talk about the theory behind interventional orthopedics, how Regenexx differs from other clinics and other products across the market, and who's this for and what kind of results we can expect. So Regenexx basically is a treatment line. It's an alternative to orthopedic surgery and an alternative pain treatment. Really, the greater umbrella is what we label interventional orthopedics. We use what we call orthobiologics as the injection substrate rather than things like corticosteroids or gels or, you know, other things. It's basically your own cells or treatments that are going to help spark your own healing response. These are advanced regenerative treatments. Like I said, they're highly researched, very scientifically based. And it's a trusted alternative to orthopedic surgery. So we're not performing any direct orthopedic surgeries. We are only doing injection treatments to help with your orthopedic issues. Regenexx is a well-known national company. We are the Pittsburgh division. There are multiple clinics all through the United States, over 60 in all at this point. You know, it's well researched. Like I said, you know, it's been on multiple different social media and media networks and platforms. So you can find all sorts of information out there on the internet if you look. So basically your current options in your orthopedic care, like if you just said, hey, my knee hurts, I'm going to go get this checked out. And you go to either maybe your general practitioner or you go see an orthopedic surgeon, a lot of the options that they're going to lay out on the table are either pharmacologic, so looking at like over-the-counter medications, anti-inflammatories, potentially even opioids if pain is really bad. There's non-surgical techniques, so there's things like corticosteroid injections, Hyalgan, which is like your hyaluronic acid or your quote-unquote rooster comb injections, or gel injections. Neurotomy, basically where they're maybe just, taking care of some of the nerves that provide pain to the joint. Bracing, chiropractic care, physical therapy, acupuncture, et cetera, et cetera. Surgery, basically indicating replacements or removing or repairing or quote unquote cleaning out or scoping or whatever it may be. And there's obviously risk associated with that. If we're talking about pharmacologic options, like I said, opioids, oral steroids, over-the-counter medications, all of these are basically temporary Band-Aids at best. And the more and more research that's done on some of these substrates, the more serious the side effects become as we see how these affect people as they age, whether it's with, cardiac effects or kidney or liver or addictive properties or other negative impacts that happen with steroids. There's all sorts of negative things that can come along with that. If we look at the non-surgical options, these also are options that are effective, but again, short-term results, oftentimes with diminishing returns. You know, I am a big proponent of chiropractic care and physical therapy and bracing, but over time, you know, these are, again, just kind of masking pain symptoms and not really helping with the underlying issue. Steroids over time now have shown to create more damage in joints with repetitive use and as time goes on. And again, there's not just joint effects with corticosteroids, there's also hormonal effects, effects with bone deterioration and all sorts of other things that come with that. So not benign in their own use, and they can cause long-term issues over time. You know, looking at the research as far as how effective orthopedic surgeries are in terms of managing even just knee pain, what we're seeing is that 53% of surgeries have been shown to be overall ineffective or unneeded in clinical trials. There's a lot of risks associated with that. It doesn't always work, and you can't undo it. So, you know, obviously, if you go from A to B and you do a replacement, you can't go back from B to A and take that back. So once it's done, it's done. Interventional orthopedics has kind of taken a different spin on just orthopedic care in general. So if you think about cardiology, when somebody would have a heart attack or when somebody would have major cardiac issues, you know, probably 20 years ago, a lot of times the solution was you had to create a big incision in the chest, open up the rib cage, get very invasive in terms of how you treated that. Now, instead of doing these big open incisions and huge surgeries, they're doing a lot of what they need to do by just inserting a catheter into a vein and snaking it up to the heart and taking care of a lot of things that way. Essentially, what we're doing now is instead of doing big open surgeries for these orthopedic repairs, we're using needle-based and image-guided procedures to just deliver the healing elements directly to where they need to be without creating big open incisions or doing big replacements or big surgeries. Within interventional orthopedics, there's over 85 different types of injections that we can utilize to help with various orthopedic problems and treating all sorts of different issues. And again, we're using your own cells, so we're not using any third-party substrates. We're not using anything that you don't know comes from your own body. So if we look across the spectrum of the difference between, you know, going between simple injections and going all the way to surgery, simple injections are pretty much what you would see in most cases where you go to either your general practitioner or your orthopedic surgeon. You know, they may do one single injection into a joint or into an area where there's pain. In a lot of cases, it's not going to be guided. Only about 4% of physicians use guidance to get that into the area. As far as interventional orthopedics, the remaining 1% of the physicians in the United States, those procedures are much more involved. We're not just looking at treating the joint itself. We're looking at treating everything else that surrounds the joint and provides mechanical stability to that area. So it's tendons, it's meniscus tissue, it's bone, it's muscle, it's ligaments. So there are all sorts of these other treatment areas that we have to address to be able to fully stabilize the joint and fully stabilize the area. If you don't do that and you just do one single simple injection, you may be missing a lot of the areas that are creating problems for people and will cause pain even after that. So we try to address everything mechanically and try to stabilize everything to the best of our ability. Obviously, if we feel like it's beyond our scope or beyond what we can do, surgery is the next step on the spectrum, which we're obviously hoping to avoid. So basically, we're looking to place Regenexx as an option between sort of your first line pharmacologic and non-surgical interventions, and hopefully even be considered even before that, because I think the earlier you look at these treatments and put them in place as an option, the better your outcomes are going to be earlier in the course of management. And then trying to get in obviously before we need to go forward with any sort of surgery. Big difference with Regenexx. With orthobiologics, there are all sorts of different orthobiologic treatments that can be considered when you're talking about quote unquote stem cell or regenerative treatments. You know, there's bone marrow stem cells, there's fat tissue stem cells, there's PRP or concentrated platelets, there's growth factor enriched injections, and there's even like extracellular matrix or amniotic injections. All of these different things fall under the category of orthobiologics. So how are we different from a lot of these other treatment options? Pretty much 80%, I'd say, of what we do is geared toward PRP or platelet-rich plasma. So most of our treatments are even platelet-based treatments, not even so much stem cell treatments. But the other 20%, we utilize stem cells in areas where we have more degenerative changes and advanced arthritis and things like that, that is really being helpful for people overall. There is a significant cost difference, but you know, a lot of what we can get done with PRP, and not everybody necessarily needs stem cells. So again, we take that into consideration as we go through your consult and as we kind of talk through things and assess the situation, and we make that decision based on what we think is going to be the best for you and your outcomes. Structure. So we're dealing only with, you know, usual musculoskeletal and joint issues. We deal with ligaments and tendons and meniscus tissue. We also deal with the spine structurally. We deal with nerve impingements and bone-related pain in some instances too. We treat arthritis. We even treat up to more severe, quote-unquote, bone-on-bone arthritis. All sorts of different tendinitis and tendon tears, torn ligaments, spine pain, which is a big one, like I said, and that ranges from, you know, arthritis to stenosis to radicular pain to disc herniations, disc impingements, meniscal tears in the knee, and even deep bone damage from arthritic conditions. We do some nerve-related treatments, whether it be impingement maybe in the carpal tunnel or other areas in the body. Once somebody has more of an advanced nerve damage issue, sometimes that goes beyond the scope of what we're able to do, but we'll be very clear about that in our assessment of your problem and how we decide to go forward. Regenexx differences, it comes down to the specialists. Why is this important? You want a doctor that's an expert in musculoskeletal care and trained in this specialty, in fact, as more than a vast majority of other doctors. You'd want more of a physician, again, that's more highly trained, not necessarily a nurse practitioner or a PA that dabbles in these sorts of treatments. That means you're going to be looking for an expert physician with the knowledge and the skill set and the experience to be able to deliver these treatments to you effectively and get the job done right. You don't just want somebody that dabbles in it as a weekend experiment. You want the right doctor that can make the right diagnosis and provide the right treatment, because that's key to the success. You want somebody that's very familiar with joint structure, joint mechanics, because you want to be able to treat everything that's affecting the problem that you're having. Cell source. You want to be looking at the safety and viability and obviously compliance with the FDA. You get only your own bone marrow cells through Regenexx that are alive and properly dosed. We have the most research approaches to acquiring these cell sources and patented approaches to actually getting the most cells and processing the most cells, which gives you a better peace of mind, better results, and obviously a better value for the injection that you're undergoing. Harvesting, you want to be able to get, like I said, the most living viable cells from your body, from your bone marrow. You want to be able to acquire the highest dose of cells possible that's harvested with the best technique and obviously with the least pain. Most of our patients say that these procedures are very minimal in terms of the discomfort, and most people don't have any problem with them whatsoever or any residual pain after the fact. We know how to extract the most nucleated cells from the body, from the bone marrow, and you receive the maximum dose for the greatest possibility of success. We also look at more of a holistic approach when we're treating joints. We look up and down the structural chain. So it's not just the knee. You know, what is the hip doing? What is the ankle doing? What is the back doing? What's the other knee doing? How are the nerves functioning? You know, what's the health of the rest of the system as well, so that we can make sure that the treatment that we're doing is not only providing, you know, good treatment for the actual pain source, but also treatment for everything else that's contributing to that across the board. So trust was another thing that we talked about. If you go on to the Stem Cell Review website and look at and type in the Regenexx in the state of Pennsylvania, you'll find that we come to the top of the list as trusted providers within regenerative treatments throughout the state. One example that I always use is this set of slides from a research study that was done on bone marrow cell colonies from populations of individuals between the ages of 50 and 70. If you look at the cell sources on the left, all those little purple dots are stem cell colonies. Those were taken from bone marrow from, like I said, patients within the ages of 50 to 70. On the right, those wells were cultures from samples taken from a substance called Livion Pure, which is an umbilical cord stem cell third market product, or third party product, I guess I should say, on the market. You can see that there's no colonies growing in any of those cell wells because none of the cells that are actually housed in these solutions are live stem cells, so they won't grow, they won't reproduce, and there's no actual research-based evidence that they actually do any actual stem cell regeneration. So big time red flags that you account for when you're looking for providers. If there's discounting or heavy emphasis on financing, or if they're changing their approach to the pricing very quickly, and it seems like it's more of a used car sale, that's definitely a red flag to monitor what they're actually doing and what actual treatment they're giving you. If they tout their treatment as a magic cure-all that they claim to treat Alzheimer's and multiple sclerosis and autism and all these other things, I would consider that a red flag. Through Regenexx, we know what we're good at treating. We're good at treating musculoskeletal issues and spine issues. We stay in our lane with that, and we don't claim to treat things that we don't think that we can. If they claim that everyone is a candidate, we take everybody's presentation on a case-by-case level and look at all the different factors that are associated with that. We look at imaging, we look at your exam, we look at everything that's going on with your body at that point, and we make a decision as to how we feel you're going to do with these procedures, and we're honest and upfront about that with you. If they're touting umbilical or amniotic or placental cells and calling it a stem cell procedure, there's no evidence that actually shows that any amniotic or umbilical formulations contain any live stem cells, so you can't really call it a stem cell treatment. Fat stem cell treatments, you can inject fat cells after some minimal manipulation as a stem cell treatment, but to actually extract stem cells from fat, you have to add an enzyme to that mixture, and that's called SVF. To do that in the United States is illegal, and any clinic that's actually practicing that is performing illegally according to the standards of the FDA. So something to just be cognizant of and be aware of. Safety, like I said, Regenexx has one of the largest published safety papers in the world. It was a paper following over 2,000 patients through their injection course from time zero all the way through their 1-year recovery, looking at any adverse effects or adverse outcomes. Overall, it was deemed safe. The infection rate was close to zero. The biggest complaint in terms of problems after the procedure was just pain at the injection sites. So no problems in terms of adverse effects. So the procedure is very safe. It's very easy to do. It's very minimally painful. Stem cells don't cause any adverse reactions in the body with, cancer or tumors or things that you don't want to happen within the joint. So all of those, there's never been a case that we've found or seen in doing this at any point in time that has shown any problems with that. So how the visits are going to work, with things like the platelet injections, these types of treatments are a little bit easier. So your initial visit with us will be a 1-hour exam. We'll look at everything. We'll examine the structure. We'll examine you. We'll look at imaging. We'll talk about your symptoms, and we'll talk about how we're going to do the treatment. The treatment itself will just involve a blood draw and a re-injection. Those usually happen about 1 hour apart, and it'll all happen on the same day. Usually about a week after the treatment, you'll start into some physical therapy to address, like I said, the structures ancillary to the joint and rebuilding some strength and mechanical stability. Follow-up will be about 1 month, 3 months, 6 months, and then a year, obviously, or any time in between that if there's an issue that we still need to address. For stem cells, the visit flow is a little bit different. The same will apply for the initial consult. That'll be a 1-hour exam where we'll go over everything and determine your candidacy. There's 3 different treatments on 3 different days that happen with the stem cell procedures, and we relate it to sort of planting a garden. The first day is going to be tilling the soil and kind of preparing the joint. The second day is going to be extracting the stem cells and then planting the seeds within the joint to grow. The third day is going to be using some additional platelets to help fertilize those stem cells and just kind of keep that reaction moving forward. After that third day, like I said before, physical therapy will probably start about a week after the end of that treatment. And usually people progress with that very rapidly. So instead of looking at that for months, we'd probably just be looking at it for a couple weeks. Again, follow-ups about 1 month, 3 months, 6 months, and a year. And we monitor progress over that time. Post-care physical therapy, you're looking at about 60% less than what you would have for surgery. We're looking at a couple weeks rather than a couple months. That we have protocols in place that we send with you to the physical therapist to, so they have an idea of what we're looking at in terms of recovery and progress. And they can always reach out to us as the providers to discuss any changes or any questions that they have about you or how you're doing or what we're doing. So we take a lot of attention to the physical therapy after the process because that's, in some cases, is just as important as the procedure itself. So who is this for? It's for, a lot of patients. Really anybody that wants to avoid surgery or doesn't like the idea of going through surgery, people that want to keep their parts and not get replaced with metal or other things, people that don't have downtime for lengthy rehab and prolonged recovery, people that don't want drugs or medications or anything else that comes with pain following surgery, people that have had failed surgeries before. We do some additional treatments related to that if we find the need. We know some people that have had bad outcomes and want to try to avoid that. Like I said before, there are some medical contraindications for surgery depending on the person's health or age, or people can also be too young for surgery. I have seen people that have had issues with arthritis or bad complications from trauma or accidents where they're just, not ready to go through that surgical process yet. Overall, the results: less pain, better function, better mood. If you have less pain, you're going to be in a better mood. We're getting people off of medications, whether that be opioids or anti-inflammatories or other chronic NSAIDs like Mobic or Celebrex or any of these other types of treatments. And we're trying to get you back to your preferred and active lifestyle, whatever that looks like to you. So how it stacks up based on cost. Prolotherapy, we didn't really discuss that much, but this is sort of our lower level regenerative procedure that doesn't involve cells, but involves more of a dextrose mixture. With this, you're looking somewhere between $300 and $650. PRP, which is our platelet-rich plasma injection. This is the platelet-based treatments. a little bit higher in price, but also a little bit better in terms of healing potential and outcomes. Platelet-based spine treatments, this is where we're using platelets and what we call platelet lysate, which is a broken platelet mixture to inject into the arthritic areas of the spine and also to inject around nerves and discs. And then at the highest level, we have our stem cell treatments, which are used to treat a multitude of different issues throughout the body that we can also discuss. Financial information and coverage, as far as like insurance coverage, insurance covers most of what we do just in the clinic. So any face-to-face visits with us, follow-ups after the treatments, also any diagnostics, lab work, imaging, bracing, and then also physical therapy, that'll all be covered by insurance. The only thing the insurance doesn't cover is the regenerative procedures themselves. So prolotherapy or platelet injections for the joints or for the spine, and then stem cell treatments. A lot of times with people's copays and deductibles, depending on if you have a commercial plan with a high deductible, you may actually end up paying more for your traditional orthopedic surgery to cover the deductible and to cover copayments after the treatment than you would actually just doing the treatment with the regenerative procedures. So again, you know, we look at customized treatment plans. We cover a wide price range. It really depends on you. It depends on what we're treating. It depends on how involved that needs to be. But, you know, everybody's a little bit different in terms of how we approach these and how we approach cost. So right now, what we're also seeing is there are some self-funded employers who have Regenexx as part of their coverage plan. So if you are an employee of some of these companies, you have access to the Regenexx treatment just as a benefit from your employer. So that is something worth looking into, or maybe even petitioning for your employers. Right now, we have about 6 million covered lives plus. And, you know, there are some companies throughout the Southwestern PA and Ohio areas that are jumping on board with this, and we've seen really good outcomes with this. These are just some of the companies sort of all over that are getting involved with this, but hoping to have more coverage through more companies, bigger companies as time goes on, but we'll see how this continues to unroll. If you are interested in setting up a in-house consultation, we recommend that you call our main office at 412-963-6480. The phone prompts will lead you to our regenerative liaison, Regenexx liaison, Sarah Furlan, and she will be happy to answer your questions and get you set up with a consult if you would like at any of our locations. Like I said, we have locations all around the Pittsburgh area. Our main location is our Gamma Drive location. That's where all of the regenerative procedures are performed, but the satellite locations all around the Pittsburgh area are also open to for visits, for consults or follow-ups or whatever it may be. So I'll open it up to questions, and I'll do my best to kind of go through this as I funnel them through here. First question is, can this be done for bulging discs? The answer to that is yes. It depends a little bit on what's going on with the bulging disc or what that's affecting or how we're approaching that. But yeah, we do it a lot for spine treatments and for disc-related pain. Second question, is there a Regenexx procedure that could work instead of hip replacement? Absolutely. We work with hip arthritis and labral repairs and all sorts of other issues related to the hip with a lot of different treatment options. So definitely worth coming in, talking to us, looking at the issue, looking at the imaging. If you have it, if not, don't worry about it. We can still see it. You know, we can definitely talk about how we would approach that to avoid any type of hip replacement surgery. Next question, can this be used for bone-on-bone in knee joint? Absolutely. Most of the patients that come in to see us are already at that quote-unquote bone-on-bone point where they're just trying to avoid surgery, and none of the other treatments are working for them. So yes, we treat that very, very often. Next question, I have a meniscal tear on the outside of my right knee. What type of prolotherapy would you recommend? I don't think that I can. So prolotherapy as a treatment is, we don't do a lot of those like ozone therapies and, pumice and all these other types of prolotherapy treatments. We do dextrose-based prolotherapy treatments in most cases. But even in that setting, the prolotherapy in a lot of cases may not even be the best option for a meniscus tear. We have seen better outcomes with the platelet-based treatments and the stem cells. So, it would be worth coming in and talking about it, talking about the results, talking about what we can do. And we can definitely look at that more closely. Anybody else have any other questions about any aspects of the talk? Oh, one more question. Oh, a couple more. Can this be used for spinal stenosis? Yes. Yes, even if you have a fusion, we do treatments in a lot of cases where people have surgeries that they've done in the past that may have worked or may still give them issues. And then they develop problems either maybe north or south of those surgeries. In a lot of those cases, we still do treatments and people still have good outcomes with that. Next question, neurosurgeon has recommended laminectomy. Is there an option there? Yes, we do treatments for the spine. I'm not really going to get into people's specific problems. I can just tell you that we do treatments for the spine all the time, and we do it for multiple different issues, surgical, post-surgical, and non-surgical. So we do treatments for the spine in a lot of different elements. If you already sent in your imaging in your exam, you will probably be hearing from us very soon to be able to get an appointment set up. There is data for recovery rates from treatments online. If you check out the website, www.regenexpittsburgh.com, there's a little guide that you can click on that has all sorts of different data on multiple different joints and multiple different outcomes. Is this treatment only available in Pittsburgh? No, this treatment's available all over the United States. There are multiple different Regenexx locations all throughout the U.S. The main headquarters, like I said, is in Denver. We are the Pittsburgh affiliate, so we cover the entire area from Pittsburgh, West Virginia, Maryland, Eastern Ohio, Southern New York, Canada. Basically all of those areas. So, there are multiple Regenexx areas, but we are the Pittsburgh location. Is the injection of stem cells a one-time injection for the knee joint? In most cases, yes. Like I said, we do the treatment in a way that, there's 3 different treatments that go into a stem cell treatment, but in a lot of cases, people are getting lasting relief. The averages on that are probably anywhere between 7 and 14 years. So 10 being the median. So yes, in most cases, it is a one-time treatment. But we sort of just monitor that as time goes on. There was one other question I think that popped up on there. I don't know if I missed it. Okay. How do you find a real Regenexx clinic near you? Kim's going to be sending out some information about the website. I would just suggest going on to the Regenexx, Regenexx website. If you look up the Regenexx conglomerate specifically, you're going to find the clinic locations that are through the Regenexx network. If you just Google, stem cell procedures near me, you're going to find all sorts of different clinics that may provide, good treatments or more likely don't provide the same thing that we do. So definitely look at the Regenexx website, official Regenexx website, to look at that information. And we have links through our website here in Pittsburgh to the actual clinical Regenexx site. So if there are questions about that, you could find them anywhere through there. Any other questions about the procedure itself or anything else regarding stem cells or anything along those lines? If not, I appreciate everybody being here tonight. You know, thanks for all the questions. I hope that you guys learned something, and I hope that I was able to help guide your treatment path a little bit. One more question. How are stem cells extracted? We extract the stem cells from the bone marrow on the back side of the pelvic bone, an area called the iliac crest. We numb that area very well with a whole bunch of anesthetic, and we do 3 poke holes in the bone to actually extract the stem cells. Most people don't feel much discomfort at all when we're doing that, or relatively very little. We anesthetize everything as best that we can, and we have some other options to help make people more comfortable. So most people tolerate the procedure very, very well, and it's usually very easy. So again, thanks for being here. If you guys have any other questions, feel free to write in or call. Hopefully some of you will be seeing us soon for consults, and we'll do our best to help you out. Thanks again, and hopefully we'll talk soon.